Tuloy mo, mana talent fee ko.
Good afternoon, sir. I'm Nurse Kit from the English University Foundation. So, what is your name, sir, for the verification?
Tyron.
Okay, sir.
Yeah.
Before we will do the procedure, I will be washing my hands, and that's it. Okay. We will do the physical assessment of your thorax, lungs, breast, and your peripheral vascular system. Is that okay for you, sir?
Yeah.
Okay. So before we will do the first procedure, I will ask him two questions. Are you an active smoker, sir?
No.
Do you smoke early? Do you have any history of smoke?
No.
Okay. Next is, do you have any history of lung disease like bronchitis, asthma, tuberculosis,
No.
pneumonia, pneumothorax?
No.
Okay. Okay. As I can see that the thorax of the patient is in symmetrical position, and the curvature of his spine is intact, and the back thorax or the posterior thorax of the patient is asymmetrical. So now I will be palpating by using my hands around the anterior thorax of the patient. Do you feel any pain, sir,
No.
when I palpate in this area?
No.
Okay. I'm going to have this. Raise your hands. Do you feel any pain
No.
or tenderness?
No.
Good. Here. Do you feel any pain or tenderness or discomfort while palpating in this area?
No.
Okay. Will you stand up, sir? And then move to
Side?
here. Yeah. Now I will be checking for the expansion of the lung of the patient. Will you breathe deeply, sir? Okay. Inhale, exhale. Inhale again. Exhale. Inhale. Exhale. So the posterior and the expansion of the lungs of the patient is intact and fine. So now I will be palpating the back of the patient, the posterior thorax. Do you feel any pain in discomfort, sir?
No.
Okay. Okay, may you
Yeah.
sit down. So now I will be using stethoscope for the auscultation of the thorax of the patient. We will check for the vascular sounds while we putting the stethoscope all over the thorax of the patient. Breathe in, sir. Breathe out. Breathe in. Okay. Breathe out. Breathe in. Breathe out. Okay, can you stand up, sir? And at the back. So go. Okay, the anterior and posterior thorax of the patient has a vascular shunt, which is normal. Okay, and I see that the body ratio of the patient has a 1.2 ratio, which is normal. For the patient who has a emphysema, it has a 2.1 ratio. So now I will be ausculting the both sides of the patient. Sir, first to the left. Breathe in. Breathe out. Breathe in. Breathe out. To the right. Breathe in. Breathe out. Breathe in. Breathe out. Okay, breathe in. Breathe out. Okay. The both sides of the side of the patient breath sound is normal. So we auscultate the right side of the patient because the right lung has a 3 lobes. So as I did this, I auscultate 3 times on the patient right side from the triangular position. Okay, sir. And now, sir, can you sit? So now we're done for the physical assessment of thorax and lungs. So now we will do now proceed to the physical assessment of the breast, areolar, and nipple. So I can see that the patient breast is round and cylindrical, and the skin of his breast is brown and has a white. And as you can see, when I'm palpating the breast of the patient, do you feel any pain or discomfort?
No.
Okay. As you can see, that the areolar of the patient is cylindrical and round. It has a brownish color. Also, his nipples are round and cylindrical. So I don't see any lesions or malfunctions that I found in his breast. So that the breast of the patient is intact. And now, we will now proceed to the peripheral vascular system. We will check in from the each sides of the pulse of the patient if the volume and rhythm of the pulse is okay. So now we will proceed now for the carotid area or the carotid artery of the patient. Okay. So after the carotid artery, now we will now proceed to the radial pulse, then the brachial pulse. Okay. As I observed that the radial pulse of the patient has strong volume. Okay. Now we will now proceed to the brachial pulse, as well as his brachial pulse has a strong rhythm and volume. So now we will check for the patient popliteal pulse. May you stand, sir? And then, okay. So now we will put the popliteal pulse. Okay. Okay. So both popliteal pulse of the patient are have a strong volume and has a good rhythm. So now we will proceed for the tibial pulse or the tibial artery of the patient. Okay, both sides of the posterior tibial of feet of the patient has a strong volume and rhythm also. And now, sir, may you put it up? So now we will auscultate the apex of the patient pulse. So that's the last procedure for the peripheral vascular system. Okay, the apex pulse of the apex artery of the patient has a strong volume and rhythm as long as the other pulse. Okay, sir. So that's it. Thank you for cooperative and responsive, sir.
Thank you.
Okay, so that is for the physical assessment of the thorax, lungs, breast, and peripheral vascular system. Thank you.